Record and welcome. Hello, everyone. Thank you for joining us. This is TJ Anderson here with Heads Up Health, Heads Up for short. And today you are tuning in to our December webinar titled Creating and Monetizing a Remote Monitoring Practice in 2021. 2020 has been quite the year, and today we're actually going to be unpacking some actual data and feedback to learn about how practices are evolving and thriving and doing it in the right way. And so we're going to be diving into the role of remote monitoring to really help practices not just survive, but thrive as we make our transition into 2021. So again, welcome. We're excited to have you here. My name is TJ Anderson. I'm the head of new accounts. I lead sales, working with a lot of our new practices, both clinical or coaching practices that want to deploy our system in their practice for their patients or clients. So for a quick background on who we are, so we're Heads Up. We're all about knowing what's driving your patient's health. Now, if you're just learning about us for the first time, so who is Heads Up and what do we focus on? So essentially we are remote health monitoring and patient engagement platform for root cause health professionals. Whether you have a cash pay clinic, whether you have an insurance-based clinic, whether you're just a coach, whether you're a physician, root cause health professionals that want to improve outcomes, drive better patient engagement, and use the power of remote health monitoring to get you there. So that's our big focus here. And so that's a background on who we are and myself. So here is the overview and our agenda. And now that I've given a background on who we are and welcome to everyone, I'll let everyone else that's joining me on our team introduce themselves, and we will keep moving forward. So Nikki, if you want to introduce yourself real quick.
Absolutely. Hi, everybody. My name is Nikki. I do sales and marketing strategy here at Heads Up. Absolutely love everyone here in the team, and I'm very excited for this presentation. You might have seen me in some of your email boxes or in the Facebook group, but I also work a lot in the community. And yeah, very excited for this presentation. So I'll pass it off to Dave.
Yes, thank you, Nikki. Thank you, TJ. Dave Korsunski here, founder, CEO of Heads Up. We're grateful for everyone's time today. And I will turn it over to Dr. Lemansky for a quick hello.
Hey, everybody. I'm John Lemansky. I'm the Chief Medical Officer. I'm an internist by trade. I run a functional medicine practice, and I'm an avid user of Heads Up. So welcome.
And our esteemed guest.
Hello, Tom Blue here. Nice to see everybody. I'll get to know you as I talk through our opener when Dave's ready.
Yes, we will. Awesome. Thank you, everyone, for introducing themselves. And if you would, as we encourage everyone coming on here, please introduce yourself as well in the chat box. Let us know where you're tuning in from. We want to know about your interests in today's presentation. So tell us a little bit about your practice and your interest in today's topic. You can just use the chat box below. This will be a really informal yet insightful presentation, and it's one that can be personal. So we want to tailor this to your interests and your needs and focuses in your work. So yeah, without further ado, I'll pass the ball to Dave to take it from here and talk a little bit more about our product roadmap.
Yeah, so this will be perhaps more relevant for those who are on the webinar that are already using Heads Up in their practice. But for those who aren't, I think some of these features will relate as well. Just a couple updates that are relevant here. One of the big updates that came out recently was the ability to do your own internal SOAP notes, which is just the ability to record internal visit notes. Also the ability to share those notes with clients, and then also the ability to create templates, which is where you can start to build up your own library in the system of all of your protocols, nutrition protocols, supplement protocols, workout protocols. We've seen all kinds of incredible protocols being created by practitioners, basically sharing their best practices for things like blue light blocking before bed, meditation practices for stress. So these are essentially templates that can be written once and deployed many, many times, tweaked for each individual. That's been a huge request. That's available. We also made some huge updates to our integration with the Apple Watch. Now, for the practitioners online, why that matters, if you have clients who want to use Apple Watch, or if you want to have clients using Apple Watch or Apple Health as part of a remote monitoring program, you can now use Heads Up to bring in metrics from the Apple Watch. So that may include things like physical activity in the form of steps. It may include calorie burn. It may include blood oxygen, which the new watch can now import. Any of the metrics supported by HealthKit Apple Watch can be imported, so you can use that for remote monitoring. We're going to have a separate webinar on that, but just know that that's one of the supported devices on the Heads Up platform. Also on that note, we are awaiting official support for our Dexcom integration. So much like the Apple Watch, if you have clients that want to use the Dexcom CGM, we are expecting final support on that integration soon. I'll use that in the demo later on, so you can see exactly how a client with the Dexcom would link it up and exactly how you can use that for remote monitoring. And then we have a new feature around being able to run reports and save those. So if you're continuously running the same type of reports, so in the example of remote monitoring, if you're running a report every month on a client's blood pressure and maybe their weight, for example, those reports can be saved and queried automatically. So those are done. Coming up next is our photo food journal feature, the ability to tag clients and put them into different cohorts. And we're also working on the ability to set notifications and alerts. So if a specific client's biomarkers, let's say blood pressure, exceeds a certain threshold, you can automatically get notified. So just a very, very quick update on the roadmap. It'll make more sense for the new people on the line once we get into the demo, but that's what the engineering team has been working on here at Heads Up. So if you have questions on that, just hit us up in the chat and we can address them. But that's just a quick update on the roadmap, and I'll turn it back to Nikki and TJ.
Awesome. Thank you, Dave. Yeah, it's very excited about what the team has been building behind the scenes and what we have that has recently come out and is also right around the corner. So appreciate the updates there. There will be a way, if you haven't tried out our system yet, at the end of this presentation, to learn more about how you can get a trial account and actually give our system a spin. So without further ado, I'll go ahead and pass the ball to Nikki, and I'll let Nikki introduce our special guest, who has some really insightful information from some great work he's done to understand the impact of COVID in a lot of practices right now.
Absolutely. Thank you, TJ. I'm super excited to announce our special guest speaker today. It is Mr. Tom Blue. He is the Director of Industry Strategy and Partnerships at the Institute of Functional Medicine, as well as a co-founder of Virtual Practices. And like TJ said, he did a really insightful study this past year, the COVID impact study that took a look at practices and some implications, as well as some suggestions and strategies for them moving into the new year. So without further ado, I'd love to turn it over to Mr. Tom for his presentation.
All right. Well, thank you very much. I'm going to share a screen here with you. Let's see here. All right. Are you seeing this properly?
We got you.
All right, great. So, hello, welcome everybody. I'm delighted to be here. I'm as you'll probably pick up over the course of the conversation, an enormous fan of Heads Up Health, and so it's fun to be able to join you for this discussion. As Nikki said, one of the just by way of a little bit of background, when COVID hit back in I guess February, March, a couple of former IFM colleagues and I stood up a sort of a rapid response resource for practitioners, independent practitioners dealing with how to kind of rapidly evolve the practice to deal with the COVID crisis and access different resources, build a value proposition for patients both infected with COVID and concerned about COVID risks, and possibly even working with employers. And so, anyway, this was something that for which there was a very clear need, and we had a very nice response to it. And by about August, we felt like it was time to kind of take the temperature of the root cause medicine community, practitioner community, to see kind of, okay, how have people weathered COVID thus far? What are their needs? What separates those who've been successful from those who haven't? and get some learnings out of this. And so we fielded a survey that turned out to be the largest survey ever fielded for the root cause medicine community. And it was really thanks to all of these participants that kind of came together and sent it for us. And so we had a really, really great representation of all of the different practitioner types. So it wasn't just MDs and DOs, it was nurse practitioners and PAs and chiropractors and acupuncturists, nutrition professionals. And so we were able to, just given the big numbers, we had 3,500 respondents, we were able to really do some very fascinating learning. I'm going to share with you right now like a really, really truncated version of this analysis as it pertains to remote monitoring and virtualization, but it was really quite fascinating. Now, as people that are invested already in root cause medicine, I want to share with you kind of the thunder of the entire research up front, just so you can kind of get a sense of what we learned. Now, by good fortune, we happened to field this survey like right on the heels of the annual Physicians Foundation Merritt Hawkins huge survey of the entire physician population. And interestingly enough, we had almost the exact same number of ultimate respondents. But what the Physicians Foundation discovered when they did this right at the end of July was that, kind of not surprisingly, doctors themselves were anticipating that COVID would hit independent practices very hard. So they say, look, there's 59% say there are going to be a lot fewer independent practices, after this thing resolves than there were when it began. Of their respondents, 8% had at that time actually closed their practice, and another 4% actually were anticipating having to close their practice. Now, again, this is a physician population. And so when you then dug deeper into this, what you found was that the practice closures actually took place overwhelmingly among the independent practices as opposed to health systems and large groups. And so it was about 76% of the practice closures were independent. So when you sort of back into that math, at the end of the day, or at the end of July, 14.5% of independent physician practices had closed due to COVID, which actually lined up very, very well with the 15% of practices in New York, independent primary care practices, that had closed by, this was like the end of April. And so as we hypothesized, this has been a crisis that really has disproportionately affected independent practices. And as we know, root cause medicine is practiced overwhelmingly by independent practitioners as opposed to health systems at this point. There's some, but overwhelmingly this population is made up of independent practices. Now let's contrast that 14.5% closure rate to the physician group inside of the root cause medicine population. And what you see here, the light sort of royal blue bar is practice closure. So what we saw here is a 2% closure rate at actually probably a month after the closing of that previous survey of root cause medicine MDs and DOs. So the great news coming out of this was that the skill set that you all have acquired and invested in of being able to sort of meet the consumer, very rapidly growing consumer need of finding underlying causes of health issues and addressing them at the level of the cause rather than the suppression of symptoms, that value proposition and the nature of the relationship that proposition creates proved enormously protective. And as you can see from this graph, just as a quick indication of how this looks, the dark blue bar here are practitioners that are doing better than ever during COVID. And so green is same as last year, I'm unaffected by COVID. So what we learned was we could not identify a single practitioner or practice attribute that would disqualify someone from doing better than ever during the COVID crisis. Now, at the same time, these are bell curves, and and within each practice, within each professional group, there were certainly practice closures and people whose revenue got hit really hard. But it was absolutely fascinating to see, and I was actually quite surprised. I mean, to see, for example, acupuncturists and kind of your traditional chiropractors, obviously hands-on practitioners, actually meeting with finding ways to do better than ever. This is going to tie, I think, very nicely into our discussion about remote patient monitoring and the heads-up technology. What we did discover is that revenue models proved incredibly important to this. So if you look at the same statistics and look at the revenue models we were looking at, what you found is there are two of them that had complete protection on the downside. So there were no membership practices in our sample that had closed. There were no practices in the that that we're selling bundled programs as the majority, as the source of the majority of their revenue. So if you generated half or more of your income from, let's say, selling a reverse your diabetes program or detox programs or Hashimoto's or whatever, you would fall into this bundled package kind of category. And as you can see, very, great downside protection. The membership practices, I'm convinced, just because of the nature of that kind of engaged relationship, have just been thriving during COVID. It's the fee-for-service practices that tended to struggle a bit more. But as we'll talk about in the course of this conversation, when it comes to sort of building out the pillar of the revenue kind of mix of a practice that using the remote patient monitoring technology and Heads Up Health, there's opportunities across all the business models. So kind of diving into that a little bit, one of the things that we saw was that by far the fastest emerging revenue source was from the sale of programs. And so one of the things I've observed is that practices, the fastest growing practices in terms of new patient acquisition, tend to acquire patients in the context of a specific problem or a specific health objective. They have their diabetes program, or they have their Hashimoto's program or whatever. And so their marketing kind of, it can be ignored by the majority of people, but those people to whom it speaks directly are very responsive to it. And so one of the challenges is in building one of these programs is it's not trivial to convert your medical knowledge into a protocol and then into a patient experience that can be priced at a set amount. There's a lot more that goes into it. And so we made this statement: if it were built for me by a credible third party or credible source, I would implement bundle protocolized bundle care packages in my practice. And what you see here is blue and yellow at the top represent agreement with this statement. And there's a humongous amount of agreement, mostly among MDs and nurse practitioners, but really across the board. And so as we talk today, one of the things I think that's going to be very exciting is to look at the most exciting sort of delivery form of one of these bundle programs, in my opinion, is now technologically integrated to include the ability to do remote tracking or even more passive surveillance of health statistics of patients. And so then looking further, we kind of at the other side of one of the challenges practices are having that it's very relevant to remote monitoring, is this notion of patients stopping the use of the practice before they've gotten the benefit. So we made this statement: patients often stop using my practice before they've gotten the benefit of what I have to offer them. And as you can see, again, across each profession, at least 28% or so of practitioners agree with this statement, and the disagreement is actually not terribly strong. Gray is sort of neutral, no opinion one way or the other. And again, one of the challenges that practices face in, let's pretend that you do sell a program, or you're dealing you're dealing fee for service with a patient, and they've come in to solve a problem. One of the challenges that root cause medicine practitioners have is how to fashion a proposition that holds the attention and engagement of patients over an extended period of time. And one of the things I would submit, and I'll talk to Dave about this, and we'll sort of unpack the concept, is that maybe the best way ever devised is by allowing that patient to remain plugged into your remote tracking platform by way of the devices that you've provided them, and allow a coach or one of your practitioners to watch over that data and keep the relationship alive, but in a very kind of low touch but high return way. And so that was so the big, among the many takeaways, have to do with the way these business models are designed. So the last thing I'll talk about is this sort of pivoting to virtual remote monitoring, digital health, and what that adaptation actually looked like. And what we found was that in fact the sweet spot for the pivot to virtual was not I'm abandoning all my brick and mortar and I'm going straight to virtual care, virtual visits only. The most successful practices were running about 30% or so virtual visits, and the balance were brick and mortar. And the theme that emerged really was that the ideal scenario is, or the objective of your virtualization should be essentially to develop the capability to flex and accommodate the needs, the access needs and preferences of patients, whatever they may be, and of the circumstances as they might unfold in every given state and market, with different sort of, sort of levels of restriction unfolding as we kind of move into cold and flu season. And so that was kind of an important thing to have discovered. So now we got into, if you think about it, one of the big mistakes that people made going into sort of making the pivot to virtual practice was thinking that virtualization was one-dimensional. It was, I'm going to take my consultations from face-to-face and I'm going to move them into Zoom or into VC or any of a number of telehealth, sort of visit interfaces. And in fact, the truth of the matter is that virtualization is a multi-dimensional thing. And one of those dimensions that's really quite critical is the use of remote monitoring technologies, again, to maintain the relationship in the absence of face-to-face contact. And so what we found was, actually, not surprisingly, a very healthy amount of interest in remote monitoring using wearables and continuous glucose monitors, but most notably with the MDs, DOs, nurse practitioners, and PAs, followed pretty closely by the naturopathic group and what we're referring to as integrative chiropractors. So really kind of across the board, with the somewhat exception of your traditional chiropractic practice and your acupuncture practices. So I was kind of heartened to see that people were advanced enough in their thinking. Now, the one condition you'll notice in this statement is if I could do it efficiently. And so this has been, I mean, having been working in the field of sort of setting up this type of practice for so long, your private pay, really differentiated practices, one of the challenges and frustrations has been, we've had this, this sort of gradual emergence of all of these awesome devices, starting maybe all the way back with Fitbit. And it was like, I can remember the moment Fitbit came out, I was like, man, wouldn't it be great if we could issue all the patients Fitbits? And what you then realized was, crap, in order to really deliver the remote monitoring kind of experience, you got to gather up everyone's password to their account and you're logging in one at a time. And it was just completely impractical to do it. And so the birth of Heads Up Health as a way for a practice to bring all this data together kind of invites us to actually say, look, if you could do it efficiently, because this is the key to doing it efficiently. And as you can see, there's a there's a lot of pent up demand for this. So my takeaways for, to leave you with, and then I'll transition into my chat with Dave, is first, if you have not already, and one of the things we saw is that very few practices had completely finished the reinvention of themselves into a more virtual kind of incarnation. So yeah, sure, plenty of practices had set up their virtual visit capabilities, but when you looked at people's desire to further implement technology, implement remote or better use of home lab testing and in-home phlebotomy, that type of thing, there's lots yet to be accomplished. So number one, don't beat yourself up if you haven't fully realized your vision for virtualization. But at the same time, we're headed into cold and flu season. It's not a time to procrastinate or be locked up. So move as quickly as you possibly can. Second is and as you saw from just the power of those two, what I refer to as value-based revenue models, the membership retainer and the bundled program models, they just performed so incredibly well during the first leg of this pandemic that I think it's very worth looking at dipping a toe into those worlds. And the easiest one to dip a toe into is the bundle programs. But starting all the way back in July, practices started converting into membership models and doing so very successfully. So don't feel like that you are in a window of time where you're stuck with whatever revenue model you came into this pandemic with, that it absolutely is a time that invites innovation. Then I would say really give serious consideration to creating these health monitoring kits. So let's pretend, for example, that you're wanting to set up a diabetes program and you want to combine an Oura ring and a body composition scale and the Freestyle Libre glucose monitor, which is somewhere on the roadmap, or the Dexcom. And so you imagine the power of those three data streams in combination with your lab testing and your coaching and sort of personalized lifestyle medicine. It's just really, really powerful. And so thinking about, okay, I'm going to create a program, I'm going to create a companion kit. And then, of course, as I'm sure all of you have probably seen these graphics, but I've been using them actually in my presentation, to a broader audience to kind of give people a sense of what's possible. I mean, holding aside the fact that you can create these awesome report cards for patients, Imagine what this now does to building the evidence base around root cause medicine. I mean, you're in a position not only to demonstrate one person at a time to patients the outcomes that you've accomplished, but you have the potential, if you do this, if you sort of repeat your program over and over, to start compiling more population-based outcome statistics and move into what I hope is the very near future of marketing root cause medicine more on the basis of clinical evidence than strictly on the basis of kind of social proof and testimonials. So, and then last but not least is something that we learned. It's especially relevant to MDs and DOs and nurse practitioners and PAs that are not primarily selling a bundle program. Those that did not implement some kind of service relevant to COVID, yeah, even if it was just a nutrition strategy for immune support, those that had nothing that was COVID related took a 13% revenue hit. So I would say if you're in those two professional buckets, that at the very least, you don't need to set up like a drive-through in your parking lot and swab noses, but at least have some kind of preventive immune support strategy that you've packaged up and are presenting that's sort of relevant to COVID. So thank you. These are my two colleagues, Andy Crosby and Lori Hoffman, that did this survey with me through Ovation Labs. And that concludes what I have to say about that. So Dave, we can pick up wherever you'd like.
Yeah, that was fantastic, Tom. There's a ton of good stuff that we can dive into. You kind of set the stage for it all. And I think one of the things we can get into next is just looking at the best ways to start integrating the monitoring technology into a practice. And there's different ways to do that, like you said, depending on how the practice is generating revenue, whether it's free for service or membership based or working on. We have a lot of our accounts that actually are working on health optimization and longevity, nothing to do with chronic disease. So there's kind of a continuum of where the remote monitoring fits in. At the extreme end, I've got Medicare patients with a qualifying chronic condition, and I'm able to obtain pretty significant reimbursements
right
at this time. So we'll talk about how to do that. And then we'll also look at the rest of the spectrum, which is I'm running programs with my clients. I'm running a 180-day keto weight loss program with my clients. And I want to be able to teach them how to measure blood sugar and ketones at home and use that as part of the program. That's starting to integrate remote monitoring technology all the way up to high performance biohacking longevity use cases where you're starting to look at very sophisticated wearables, heart rate variability from the Oura Ring, deep sleep metrics, advanced labs. So there's a lot we can cover on the spectrum. And we're also going to do a demo here for those who are on so we can kind of make it real. But I should probably turn it back to Nikki just to keep us on check with our agenda here and make sure we're not missing anything.
So far, we're all set. Yes, going over the top 3 mistakes when going virtual, we touched on that, as well as the difference between the membership bundled programs and the Medicare fee-for-service.
One quick question to survey the crew that might guide us all moving forward. If you're still on and watching us, a part of this webinar, we appreciate you being here. We'd love to know what type of practice you run. And I think one of the maybe easier questions is like cash pay versus insurance. So maybe we could start there. If you want to use the chat box, just let us know a little bit more about the type of practice you run. And based on the offerings and the types of business models that Tom went over, we'd love to hear what type of practice you've set up. So that can help guide us all. Awesome. People are starting to share. Appreciate the feedback here.
Yeah, so thank you, TJ. We'll take questions as well as they come in. But at this point, I'd like to chat with Dr. Lemansky and Tom. John, maybe you can just start off at the farthest end of the continuum where we started, which is how to use these remote patient monitoring codes that initially came from CMS, which was a huge win earlier this year, where a lot of the diagnostics that needed to be done in the office could now be done virtually. And there's about 3 or 4 RPM codes, maybe more at this time. But maybe you could just start with a brief overview on those, John, what they are, how they can be billed, and then we can segue into more of the membership lifestyle packages as well. And I'll fire up a demo here while you're talking, and we can go into some of these metrics.
Yeah, absolutely. And Tom, that was a great presentation. So I do want to thank you for that. You know, one of the benefits, if we can say benefits of COVID, is this transition to online telemedicine, telehealth really has exponentially increased in terms of the time frame. And so one of the responses from CMS, which is kind of the Medicare services, was to see how can practitioners be reimbursed for monitoring from remote. And so there are a few, there's quite a few, but the ones that are really applicable to us if you're doing insurance-based medicine, but even if you're doing cash-based, still can be advisable to do as a value add. So anytime you're going to set up a remote device, so Tom showed a few, such as continuous glucose monitor, anything as simple as blood pressure, heart rate monitor, oxygen level monitor. All those things can be billed for the initial setup for patients.
One time.
And that one time, yeah, that's a one time within a 30-day period. And it's not a huge bill that you're going to get or a huge reimbursement, but if you're doing it over a significant amount of your patient population, then it can definitely be an added revenue stream that just comes in.
Hey, John, can I jump in for a second before you
sure.
move that topic? So, Tom, maybe you could also speak to how we can start to position the health coach in the practice to be able to do a lot of the initial device setup, for example, with patients.
Well, I will tell you, the between the concepts of building bundle programs and remote patient monitoring, I think we now have in front of us the way in which coaches will begin to find their way actually into real collaboration with physician practices. The challenge that sort of plagued the coaching industry is, there's this massive aspiration of coaches finishing their training and magically finding themselves working collaboratively with doctors. The problem, of course, is that the doctors have no prior training on how do you manage and monetize a coach. So it just becomes a person on the payroll that the doctors then got to figure out how in the heck am I gonna break even on this new resource? Well, with remote patient monitoring, the fantastic thing is about the way that that the billing regulation or guidelines work is that it's a pretty loose definition of the quote clinical staff that can kind of do the heavy lifting of setting up devices, getting people onboarded, even following the data, particularly if the doctor has laid out some standard protocols that they're wanting to sort of those tripwires that they're wanting to be notified of. And so it creates just what I think is an absolutely terrific way of starting to integrate coaches and not having to worry about having no way of compensating that function. The other thing that we discovered actually in the research, I didn't share this, but when it comes to coaches, we had very strong agreement with, particularly among MDs and DOs and nurse practitioners and PAs, with the statement that I would utilize a health coach if I could monetize them as part of a bundled program. So as you design, what you find is when you design these programs out and you choreograph them, you quickly realize that the bulk of the workload of an episode of care in root cause medicine is actually carried day in and day out more by the coaching function than even the medical function. There are critical points along the way for the lab interpretations and medical consults, but in terms of supporting the behavior change that ultimately will dictate the long-term success of the intervention, it's the coach that carries that. So it's these bundle programs are a perfect way to monetize the coach without having to put them on the payroll. So I'm so excited about the combination of these two things for the future of the coaching profession.
Yeah, so John, that's just related to the setup. So whether you're working with clients directly to help them get the devices set up, or whether it's through the coach, those setup codes are one of the first ways that you can start to monetize the coach. One thing we've seen as well in our conversations is that oftentimes the coaches are much more technology savvy, if you will. And they're more than happy to get in there and start getting Bluetooth devices connected and getting in the weeds on that stuff. So that's that initial setup code, John. It's a CMS code. It's also got other carriers that can reimburse for it. Again, we're speaking strictly to the fee for service here now. We're going to talk about bundled and membership later, but that was the first one you were going to cover. I just wanted to get the health coach case in there.
No, and absolutely. And I think obviously with the, if you're billing insurance, you're going to get a set amount of revenue from that. But one of the points that I wanted to make from like the health coach perspective is it's a great way of having user engagement. So, when you have data that you can maybe have like an email chain, attached to it, basically encouraging the patient population to improve whatever metric you're looking at. So it can be a huge value add, not just from a monetary perspective, but just a way of continuously engaging your patients. As Tom mentioned, not like overtly, but just very low level engagement. And then
I'll steal Tom's line on that one, John. He likes to use the term "fetch good news." So
I like that.
There's always some good news in the data that you can use as an engagement opportunity. I do it all the time with the people I work with on the system.
Absolutely. And then, so, the continuous monitoring of these data points, again, can be billed at a little bit higher level, and that has to be within a 30-day period also. And you have to, meet certain metrics where you're actually monitoring the devices. They have to be Bluetooth enabled, or it's not like the actual patient just entering the information. It has to be directly sent to you, and you get paid at a higher level. And then there's some other ones that have changed recently. Some are going to be permanent, and some are going to be phased out in 2021. But those are billed at a little bit higher, and it's just basically how much time are you spending actually communicating with the patients the data that you're looking at, and actually engaging and making changes to whatever treatment plan that you're doing. So, I mean, you can if you have a significant amount of patients on your program, you can still generate a pretty good baseline revenue just from looking at data, engaging with your patients regarding their data.
And I would imagine, John, that even for the practitioners on the line here who are not working in the insurance model, they're working on a cash pay, or they're part of a membership concierge or part of a program, the ability to integrate the data remotely provides an opportunity to engage with these individuals, and also to help, I guess the right word must be to just to provide some additional value on the program. If you're able to, so for example, if you have clients who are at a high COVID risk, for example, and if you're able to remotely monitor their body temperature and their blood oxygen and their blood pressure and their resting heart rate, that is incredibly valuable to an individual who's at high risk, regardless of how they're paying you. That can be extremely reassuring. And so on the screen here, John, I've got a couple COVID metrics as an example of metrics you can monitor remotely. And if you do have patients who are concerned, even just being able to review body temperature on a daily basis, immediately you're going to be able to start detecting anomalies and decide when you need to have an intervention, or if it's blood pressure or blood oxygen. These are some of the vital signs that can be used remotely. So the example is being able to use this as part of a remote monitoring program, regardless of how you're bringing in the revenue. I think that'll be incredibly reassuring just to know that someone's on the other end and keeping an eye on these metrics. Most people don't even know how to interpret blood oxygen, but it's incredibly valuable. So just using this as peace of mind and as just part of the value of the service you provide, regardless of how you monetize it.
Yeah, absolutely. And I think, I mean, obviously we rolled something out early on with COVID to kind of help our clients, really monitor their patients for COVID. I think the main takeaway I would say is the value add. So what is going to differentiate your practice from other people out there? I think that, you can have a bundled program where you're putting out protocols, but what are the metrics that you're using to basically show that you're causing benefit? From my perspective, I think the data that you can glean from the devices that we have integrated into Heads Up will give you an edge above everybody else, because you can show, as Tom mentioned, not only for your own patient, but for the patient population, the dramatic changes that you're creating for them from whatever protocol you're using. And then over time, you can use that as marketing material saying, look, with these 1,000 patients, this is the overall benefit that we provided. And it's not subjective, it's objective data, which is very hard to come by in other platforms, I think.
So I've got a demo account set up here, John. You can see for those who do want to do remote monitoring, this is how you would set up. These metrics can be customized. So we have practices on here that are running keto weight loss programs. And they're looking at blood glucose, blood ketones, weight, body fat, for example. We have practices that are doing purely vital signs monitoring. These are some of the metrics that qualify for the classic RPM billing, which is blood glucose, weight, blood pressure, blood oxygen. It can also get into much more sophisticated metrics. Those that would come from, for example, a sophisticated wearable like the Oura Ring, where you want to start looking at deep sleep, heart rate variability. So I'll just crack this one open, John, but this would be an example of a test account that has kind of the classic remote patient monitoring metrics. If I'm not mistaken, Tom and John, these are the ones that are RPM eligible, assuming you have an individual with a qualifying chronic condition. But I'm just showing this as an example of how an individual client or patient, depending on your practice, would be able to start connecting in and sharing data remotely, and then how that gets included in the practice offering, whatever that might be. So maybe you can take us through these, John, and just share your thoughts on how they'd be used in day-to-day monitoring. And Tom, your thoughts on like how the health coach gets involved here and where the opportunities are.
Sure, and just to mention that the metrics that you can actually use to qualify are expanding, as the technology gets better and as CMS, which is kind of a lagging institute, kind of catches up to what the technology is offering. So, I mean, I think most people know what these metrics are, but obviously, if somebody's not very data savvy, weight is going to be the end metric for success, basically, for a lot of people. Unfortunately, I think there's a lot that you're missing with just weight. I mean, you're missing muscle mass. There's a lot of things that are faulty, but let's say that's all you can, thanks for adding that, but that's all you can come up with. Well, then at least you have some metric to show graphically, okay, this is where you started at, and here's the trend based on what program we're using. I think glucose, we were talking about Dexcom and the Freestyle Libre. I think that's going to be a game changer once that is adapted more universally, which it seems like the trend is. Because glucose really is a reflection of so many metabolic changes that once we have kind of the continuous data, you can make significant changes and see in real time how that's affecting your glucose levels.
Yeah, I've been testing the CGMs, as have a lot of us here at Heads Up. Tom, I know you've done some testing with the Dexcom. Incredibly powerful for individuals to self-regulate and to be educated. And now we have ways to connect that in here so that you can actually do some remote consultation, and you can look at an individual CGM data over the last week, see what the highs are, see what the lows are, start to figure out what exactly it is that's causing glucose spikes. So we now have 24/7 insights into people's metabolic health and seeing, wow, your glucose spikes right before bed. And why is that happening? And the technology is getting so good that we're getting really, really powerful ability to do this kind of remote monitoring. So I've just got a few examples here of different metrics. We can get into more about how to get all this set up, but
hey Dave,
well, yeah.
Just one thing on that also that kind of differentiates Heads Up is, so yeah, you can have like a continuous glucose monitor. I mean, you can have a Dexcom, you don't need Heads Up, right? You can just look on your device, but I think the correlation to different lifestyle changes is what is really beneficial with Heads Up. So meaning if you have an Oura Ring, or if you have some way of measuring your HRV data, you can correlate what's the glucose trend based on my HRV, what's it relative to my sleep data, what's it relative to my exercise data, my heart rate. And so you can start really formulating a overall picture of each patient client based on this kind of aggregate data instead of just individual data, as Tom mentioned initially, where you have so many devices, but none of them talk to each other. So you're spending the whole time just trying to figure out how do these actually integrate in terms of what I'm trying to do for the client. So, I don't know if you can pull up kind of a graph representing glucose plus like HRV, but I think that's a very powerful utility from Heads Up.
Yeah, so I'll just do a quick example, and then I want to turn it back to Nikki and Tom just to talk a little bit about how to even get started with this. So how would I start to pick some devices? How would I start to set this up? How would I start to monetize it? But just to get back to John's example, here's a Dexcom feeding in, and I'm able to, for example, run a 30-day report on blood glucose data, and I may want to overlay that with heart rate variability, for example. So these are two completely disjointed data sets, one coming from a sensor and one coming from a ring-worn device, and I could very easily overlay those two. More important than overlaying the two is trying to actually, sorry about that, is trying to determine whether or not the results have improved since I've been working with this individual. Mm-hmm. So I can look at the last 4 weeks, and we will automatically tell you if those results have improved relative to the prior 4 weeks. So you can see immediately that this individual has seen an 8% increase in deep sleep over the last 4 weeks compared to the prior, a slight increase in blood glucose. But if you are using this for RPM, you can start to get the reports you need. You can export this data, you can attach it to the claims, you can send it as a report to the client. So lots of different ways to use this as part of the engagement, part of the bundled package, the membership, whatever it is.
Dave, before we move on, we actually have some questions in from one of our attendees. They're asking, how does the monitoring increase our reliability and demand from the patient? And how does that connect to a workday or a human responsible for the metrics and ultimately the health/life of the patient?
Yeah, I think that just depends a lot on the type of individual and the practice. So, John, do you have thoughts on that one from your personal experience?
Yeah, I mean, I think from a liability perspective, you have to have it kind of outline. Oh, where'd it go? Outline in terms of, you know, what your responsibilities are towards your client and what the responsibilities of the clients are towards you. So I think if you have a good kind of initial agreement, that should be covered. How does it increase the demand from the patient? I guess my question would be in terms of like, what do they need to do, or what demand does that create on you as the practitioner? I think, as Tom mentioned, if you have, let's say, if you're a practitioner and you have health coaches underneath you, really, you know, going over the data, then it really doesn't add any extra work on you except for reviewing it, you know, if there's a significant change. You know, most devices at this point are Bluetooth enabled, they're automatic. So
they're FDA approved.
Yeah, they're FDA approved, but they automatically send the data to Heads Up. And so I don't think it necessarily adds significant amount of workload. If anything, I think it expedites what we do because you can see right away if there's an outlining, you know, metric that you need to really focus on. As far as the ultimate health and life of the patient, I mean, we're a very data-driven kind of network where we believe that you can use data for your advantage in order to help your patients improve their health. Because at the end of the day, that's really what we're all here focused on, right? It doesn't matter if you're an MD, a DO, NP or ND, or whatever practitioner you are, your goal is to help prevent patients from getting sick. And so I think the best way to do that and reflect the benefit of whatever protocols you are initiating is the data showing, okay, look, glucose started at 140, and after 6 weeks working with me, their average glucose is, you know, 100. I mean, that is irrefutable data that you are improving that person's ultimate outcome.
So there's another one here, Nikki. How are alerts set up, and what are the pluses, minuses expected on the devices? Yeah, that's a really good question. So we will soon in Q1 support the ability to set alerts, because you can imagine if you have dozens, hundreds, or thousands of individuals on here, it becomes very hard to do the anomaly detection. So we will support the ability to set different thresholds where you can get notified automatically when values get out of range. We'll get more into that on an upcoming webinar. And then the other question is, well, there's probably a lot to unpack here, but what are the pluses and minuses on the devices? And I guess I'll answer that in two parts, and I'd love comments from the other panelists. But in terms of the traditional vital signs, blood pressure, blood glucose, blood oxygen. Those are very simplified. The devices are well understood. They're all class 1 medical devices. They all have to adhere to some range of accuracy as part of the approval process. Is that correct, John? Just to get the certification. So as long as it's an FDA approved device, and if you're using it for RPM billing, it does have to be connected, but we support just having people enter it manually. In fact, for a lot of low tech clients, it's actually easier just to have them punch it in once a day. Sometimes the Bluetooth can be finicky. So there's the traditional vital signs devices, and then there's the sophisticated wearables, and that's kind of a whole separate conversation. And what I would recommend is that you actually test them yourself and learn the pluses and minuses. Then you'll be actually best empowered to help your clients that have those devices, because they are all different. They all have their own user interface, their own app. They present the data differently. So it's really kind of incumbent on you to develop your own subject matter expertise, or have the coaches develop the subject matter expertise and handle that part of it. So that'd be my answer. Any of the other panelists here have anything to add there? No?
No, I mean, I would agree with what you said.
Me too.
All right, cool. So anything else, Nikki?
For the first question about demand, I think they were asking more or less, for example, say during COVID, a patient is getting towards critical. So if there was an alert and it was leaning towards critical around 1 o'clock in the morning, say at a time when their offices are closed and they're continuously collecting that data, how would a health professional respond? I think that's assuming that alerts are coming through continuously, but that was essentially clarification for demand.
Yeah. Yeah, I mean, I think that's individually based, you know, okay, yeah. So, you know, I think in terms of each practitioner has to have a policy in place. These are the hours of operation, you know, because yes, as the practitioner, you're getting the alerts, but the patient or client is also getting the alert. So I think it's unusual for let's say something with COVID with oxygen levels from going from normal to, you know, in the 80s that quickly. But I think if you notice a trend, you would have the ability to say, okay, look, I'm noticing a trend. I think we need to prepare that maybe you need to go to the hospital and get seen and seek higher care. So having a plan in place might be a benefit of actually having the data being streamed to you. But yeah, I think it really depends on the practitioner and what their policies are outlining initially. Like for me, for instance, I'm not up 24/7. I've done that. I don't do that anymore.
Great
so
point.
I have it very, you know, clear. I mean, I'm up 24/7 because I have 3 little kids, but not for patients. So I make it very clear, you know, I have a emergency line. If somebody has an emergency, you know, there is somebody there to talk to them and kind of guide them. But by and large, it's going to the emergency room at that point.
Nikki, TJ, you want to start to wrap us up here?
Yeah, well, I think I want to also briefly touch on, since a few of the majority of the people that share, they mentioned cash pay was their focus, and maybe one was a hybrid. But Tom, when you were talking about bundled programs and membership models, so you were alluding to how like remote monitoring helps to propel and elevate those sorts of offerings. If that's the case, can you speak to that a little bit more, and like why and how that can be done in a like you said, in an efficient way, and what are some of the challenges that have been in the past in that category for people?
Sure. So if you think about, we'll start just with a membership practice where, you know, I can't tell you how many doctors I've talked to over time as they make the transition into membership medicine where they're actually afraid. They're like, what happens if I have a patient who doesn't get sick during the year? And so, you know, because it's like, how will I show up and deliver value? And you know, heretofore, it's always required a fantastic annual health assessment, build a health management plan, you know, that's health promoting and wellness oriented in order to do that. But even still, that's an event followed maybe by some consultation. Imagine now if you're a membership practice, if you say, look, okay, as members join, maybe you pick a more a universally applicable device like an Oura Ring that's looking at sort of wellness data across a variety of sort of lifestyle factors. And that becomes your go-to device that you're using to create a window into that patient's life and again, tie into your coaching program. Or maybe you say, as patients come in, I'm going to look at, we've got our people that are, our hypertensive patients get a blood pressure cuff. People that are on a weight program get our body composition scale. People on, pursuing insulin sensitivity get a CGM program. You know what I mean? And you've got a few kind of patient archetypes that have a different device that you've pre-picked, and you always work with the same one. So your team's not constantly having to learn and listen to or learn about every device people buy on Amazon. You want to maintain control. And I do think that's actually an important theme of this latter part of our conversation, even as it relates to liability. Establishing the ground rules. These are the tools we're using. These are the times of day when we're monitoring it live. And I have to say, I love the idea of having a COVID surveillance program as do employers, by the way, to keep people from going in and out of the ER every time they feel panic. I mean, the news has been full of just tens of thousands of claims dollars being run up by people without access to any kind of remote monitoring, just going in and out of the ER every time they feel short of breath. And so, what people have to remember is, again, documenting some basics, some foundational expectations, but recognize this is a radical upgrade in the quality of your care. I think actually at a certain point, we may be asking the question of what's the liability for not doing monitoring. And so, I'm not even kidding. And this is maybe not in 2021, but at a certain point, I think you're going to start to look pretty foolish if you're not. So anyway, so now let's think about the bundle program folks, or someone even trying to just dip their toe in the bundle program world. And here again, if you think about, start by thinking about what is the health objective that you want to build a program to solve. And, whether it's a particular condition or a particular health aspiration. And then think to yourself, okay, well, if I could create a window into the life of the patient, to build both a higher resolution picture of that patient and a better understanding of the context around this health objective, what would be the right device? Is it an Oura Ring or a ketone monitor or whatever? And the great thing about Heads Up, you guys have integrated with such an awesome menu of devices that, that it's not, it would be very surprising to me if people had an objective that they wanted to meet and you guys didn't have an integration that really was quite relevant to it. So anyway, you pick that device and that becomes your toe in the water. And where I have a hunch people will find that these devices really, really shine is when the program's over. And instead of the way it is today, where it's like, you reach the end of your 6-month diabetes reversal program and the patient graduates back into day-to-day life. 6 months later, you see them in the grocery store and they're back to diabetes again. They look just like the way they started. Now you've got something they can graduate into, which is supportive, but light touch. And so, and again, every time the patient looks at their hand, the back of their arm, whatever, they realize, hey, I'm still engaged with the practice because I'm plugged into this platform, this surveillance platform. And if I don't sleep for 5 nights in a row, I'm going to get a phone call from a coach. So it's to me, that's another great place to start. It's kind of, I sort of, as I said about telehealth tools, this is an area where it doesn't hurt anything to give it a try, to carve out 5 patients and pilot it yourself. It's not like you're changing your EMR, and you've got to research this till the cows come home and it's going to be a massive pain in the neck. This is an easy thing to stand up. It's an easy thing to try. And by the way, my other speculation is the more people are wearing your practice on them in the form of rings and discs on their arm, the more they're going to be talking about your practice to their friends. See this thing? My doctor's watching me 24/7. You know what I mean? You kind of can't help but to brag about it as a patient. So I think in terms of the virality of what you're doing, it's we don't talk much about just the marketing benefit of having patients wearing your practice on their body, but I think it's a big deal.
That's a great point. Yeah.
Yeah, I'm going to use that as a marketing tool. Thank you, Tom.
Well, thank you so much for the insights on those two different models there. And the other thing to mention, and we'll go over and review here and close it, is you can position this differently, however you'd like. And when I'm having calls with individual practices to learn more about their individual use cases and their instances, it's, depending on your offerings, you can position this as a self-management tool to one type of patient, and then maybe a higher end patient, you position that with plus coaching. So now that we're wrapping up here towards the end, just to kind of in review, I'll go over briefly these bullet points, and then we can kind of talk next steps here for everyone. So overall, of course, 2020 has really played a big role with kind of forcing or nudging people to have to explore going virtual. And there are lots of opportunities out there, right? And with the right strategy and technology, as Tom mentioned, avoiding key mistakes by operating as a hybrid. So remote plus in person a little bit could be important for you, but overall really focus on determining what is your financial model going to be. Is this going to be in a membership? Is this bundled programs? Is this fee for service or a hybrid? And then explore like what is the best technology, to Tom's point, that's not gonna really eat up a bunch of time and energy for like changing your EMR. This is a tool like Heads Up that you can have run alongside your existing tech stack, whatever that looks like, to really help centralize and analyze that data. And then we're here to help you scale that offering, help you position that to your patients and clients. So, a couple next steps here, and then I'll pass it to Dave. Any final words? But if you are interested in exploring further, if we haven't already connected, I know we have a lot of clients that have been on this webinar and a lot of new faces and names as well. You can get started with a free trial. Follow this link here, and maybe Nikki can put this in the chat box. So headsuphealth.com/professional to learn all about our professional solution to help you deploy this in your practice. You can get a free trial there. And then of course, contact us for a personal demo. We're here to support you tailoring this, customizing this to your practice and your patients and the goals and the data you want them to focus on. So yeah, Dave, any other parting words for anyone?
I guess I would just say that there's a lot of different ways that this technology gets deployed. We have accounts that are only monitoring 2 metrics on a client's dashboard: blood sugar and ketones.
Right.
And we have others that are using this to actually only monitor lab results from Quest or LabCorp. And we have others that are using it in a hybrid model where they're looking at lifestyle data and clinical data and functional data. So there's lots of ways to set it up and configure it. Our team is available to get on a call with you, answer questions, run through demo, whatever you need. So lots of ways to set it up and customize it for what kind of outcomes you're looking for.
You bet. And we have all different types of health practitioners. Here's a shout out from one of our great clients, Dr. Kevin Sprouse, founder and head physician at Podium Sports Medicine. Talks about the power of bringing in all different data sets to overlay those and analyze those. And this is another example. This is one of our clients who utilizes our white label features. So Megan Ramos over at the Fasting Method, her and her co-founder, Jason Fung, have a really strong membership program that has added Heads Up as a tool, and their client retention rates and engagement rates are just skyrocketing. And as you see here, she talks about just like how really easy it is to use. So that's kind of where we wrap up here today. We're just so grateful for everyone that's been a part of this presentation. So grateful for Tom for being a part of this, sharing his expertise and his data, his feedback, what he's learned from the impact that COVID has had on a lot of practices. So we can go ahead and sign off here.
Thank you, Tom. Thank you, Nikki, John, TJ. Thank you for everyone who joined.
All right.
Thanks, everybody.
Cool.
Thank you.
We'll be in touch. Thanks, everyone.